Hi, I am Dr. Raghav Malik, consultant, cataract and refractive surgical sciences at Center for Sight. Today I'll discuss with you the type of lasers we have in refractive surgery. So let's understand what exactly refractive surgery is. So refractive surgery is the science of removing your spectacle power. So there can be many reasons for you having spectacle power. It can be a change in shape, it can be a change in your nutrition, or multiple factors can cause you to have spectacle power. But the science to remove it is called refractive surgery. So this refractive surgery is done by many ways. The most common is a laser vision correction, wherein a laser is used to reshape the outermost part of the eye or the cornea. The cornea is the outermost layer of the eye through which the light passes and enters your retina or the nervous system of the eye. So broadly speaking, there are two types of lasers that are used in refractive surgery. One is known as a femtosecond laser and the second is an excimer laser. So these lasers are very fast. They are used to reshape your cornea. So in a femtosecond laser, the laser fires for a very brief duration of time and it is used to make cuts in the cornea. While the excimer laser, also known as excited dimer laser, it is used to burn the tissue in the cornea. So the femtosecond laser cuts and the excimer laser burns. So there are different types of procedures. I will name three procedures. One is the PRK procedure, in which no flap is created. The second type of laser is a bladeless LASIK. In a LASIK, we have different types of LASIKs. They can be different names based on the brand that we are using, including Contura LASIK or Amaris LASIK or customized LASIK or wavefront guided LASIK. All these surgeries are types of LASIK wherein a flap is created and then one more laser is used to burn the tissue of the stroma of the cornea to remove the power. And thirdly, we have the Calyx procedure, wherein we have procedures like the SmartSight, the Silk, the Smile and the Clear procedure, wherein a lenticule is made within the cornea and a small lenticule is removed. So I'll discuss these three procedures quickly and I'll tell you how these lasers are used in these procedures. So in a PRK procedure, also known as a photorefractive keratotomy, or it can also be known as a trans-PRK or a smart light or a smart surface procedure. In this procedure, imagine this is the cornea or the outermost layer. So the outermost layer of the cornea is known as the epithelium layer. So it is a single step procedure wherein the patient looks at a central light and then one type of excimer laser falls on the top layer and removes the top layer or the epithelium. Then one more type of excimer laser falls on the stroma and burns some tissue and reshapes the cornea. The curved cornea becomes flat and your power is removed. So in the PRK procedure, only one type of laser known as the excimer laser. Now coming on to the LASIK procedure. Like I said, the LASIK is a two-step process. In the first step, a flap is created and in the next step, the corneal tissue is burnt. So the first step of LASIK procedure requires a femtosecond laser. So the femtosecond laser is used to make cuts in the topmost part of the cornea and make a flap. So imagine if this is the cornea, we fire a femtosecond laser and we make a flap on the cornea. Once the femtosecond laser has made a flap, then a second laser or the excimer laser falls on the cornea and burns tissue to just flatten it. And once this is flattened, your power is removed and the flap is kept back. So again, in a LASIK, two types of lasers are used. Firstly, the femtosecond laser to make a flap on the cornea, and secondly, the excimer laser to burn tissue and remove the power. Lastly, coming on to the Calyx procedure or the lenticule-based procedures. In the lenticule-based procedures, only one type of laser is used, known as a femtosecond laser. The femtosecond laser is used to make a small cut within the stromal surface of the cornea and a small lenticule is removed. So it's simply, imagine you have a letter that you receive at home. You open the envelope and on one end, take out the letter and close the envelope. So the refractive surgery known as the Calyx procedure is similar to that, wherein only a small cut is made and a small lenticule of the cornea is removed. This is a single step procedure and only a femtosecond laser is used. So based on the type of refractive surgery that you are undergoing, different types of lasers may be used. But broadly speaking, there are two major lasers. One is an excimer laser and the second is a femtosecond laser.
Follow Planet LASIK and post your queries to get answers from the experts.